Share my screen. I'm going to share my screen with you and kind of walk you through. Let's see if this is it. I don't know why it's doing this. Give me a second. Okay, you can't see it, right? It didn't work. It's telling me I have to quit Zoom and relog in. Let's just try one thing.
Okay. Yeah, too many technical difficulties. We can't do it again. Okay.
Do you see it now?
Yep.
Okay. Here we go. All righty. We did it. So Kendall, just for your information and anyone else who's listening, my name is Eileen Michaels, and I'm very happy to be here with you. Stephanie and her colleagues invited me to speak with you about your job search and hopefully to give you some information that will help you as you undertake your job search and help you as you make a decision as to which is the right position for you moving forward. I know that within the AHEC Scholars, there is a variety of people with different professions and interests. What I'm personally not that familiar with for each of you, but you are invited to please reach out to me, and my contact information is at the end of the presentation, and Stephanie has it as well. But one of the things that when I speak with you, I'll be asking you about is, a little bit about what your preferences are. And it's a good time now to start to think about, if you haven't already, geography. And I would say that from the context of giving some thought to how you want this next step of your life to move forward. Where do you want to be? What hours do you want to work? Do you want days, evenings, some combination? Are you open to working on weekends, which is something that comes up for healthcare professionals frequently? A for-profit or a not-for-profit employer, all of these things that are listed here. But in addition to that, things like, are you looking for a position that has a career ladder? Or is this first position something that you're thinking about as a place you want to land and get your feet wet for the first few years and then move on from there to do something else? Are you anticipating that you will be going in search of additional degrees or training within your field or outside of your field? So those are the kinds of things that if you work with a recruiter or not, you should really give some thought to as you undertake your search for the right position. So like I said, my name is Eileen Michaels. I live in the Capital Region. I've lived here over 30 years. I have worked in many different healthcare organizations. My background is that I started out actually in labor relations, and my first labor relations position by a fluke was in a hospital. It was actually a hospital that at the time was owned by the U.S. Public Health Service. And that was my first introduction to healthcare. I never anticipated that I would have an interest in anything related to healthcare. I'm quite squeamish, actually. And the sight of a scratch on a knee can send me into an absolute weak-kneed position myself. But I loved it. And I loved most of all working with the people who were healthcare professionals. And I just found them to be just wonderful human beings as a rule. And that's what drew me to this. So I've been an administrator at Columbia Presbyterian in Manhattan. I've worked for Kaiser Permanente, which you may or may not be familiar with, which owns hospitals, health plan, and medical practices. Here in the capital region, I managed 5 counties of outpatient healthcare practices that were part of Kaiser Permanente system. And then in 2006, I decided that I wanted to sort of move my career in a different direction. And after having been on the operations side and the HR side and the marketing and public relations side of healthcare, I decided to go into recruiting. And so since 2006, I've been focused on recruiting licensed healthcare professionals for employers who span the country, depending on when I'm doing it and who I'm working for, large and small hospital systems, independent medical groups, two doctor practices, community health centers, federally funded community health centers, and health insurance plans. So I kind of see things operationally from all different angles, and that helps me. It helps to inform how I work with the candidates that I do work with. So what I want to show you here is just an overview, really a large macro view of what in the world is going on in the healthcare job market now. And when you look at these bullet points, I'm not going to read them to you, but when you look at this, keep in mind that what we're seeing is healthcare as a sector has been for many years on a much faster growth trajectory than most other sectors. And the number of jobs that have been added in healthcare across all different healthcare occupations has been growing much faster than you would expect in other sectors. What happened during the pandemic is actually pretty interesting, because as a recruiter, I saw this very early on, that hospitals and medical groups started to experience such changes in the dynamics of the flow of patients into their systems that it caused them to react in some ways in a knee-jerk fashion, and in some ways in what was carefully planned, but not exactly planned for the circumstances that they faced and the suddenness of the changes. And so I recently, with Kelly, spoke with a group of physician assistant students and actually was telling them that of all the professions that I've worked with in healthcare during the pandemic, the people who were laid off the most, in my experience, were the physician assistants. And it happened in specialties in particular, where elective procedures and elective visits suddenly plummeted, and space and beds and resources were needed for COVID-related care. And so, you look at some of these statistics and you say to yourself, well, are people just moving around? With all these new jobs that are growing, how many of these new jobs are being filled by people who are already employed, but now moving to new positions, versus how many are being filled by newly trained individuals, like I'm assuming many of you are going through your training now. You will be taking a look at this, I think, from a perspective that is very centric to yourself, but it's very interesting, in my opinion, to look at it from a larger market perspective. And as you move on in your career, you'll find you can move within healthcare organizations, and you can move geographically in healthcare, and very frequently run into people who you've already worked with before and meet them again. There's a lot of that happens in healthcare. And a lot of it has to do with the training that the healthcare folks have. There we go. Okay, so this is just a peek of what I did. Was I broke this out from the perspective of what's going on with hospital employment and what's going on the outpatient side. And so there are some components of healthcare that really don't fit into either one of those buckets, but by and large, many things do. So on the hospital side, you can see that the job growth is significant. I mean, 15,000 jobs a month in hospitals for a sustained period of time over a year. That's a lot of new jobs. Remember that we're reaching a time where a lot of baby boomers are retiring. And so the rate of retirement in healthcare is significant now. It was bumped a little because of COVID, but it really is on a trajectory now. And so in addition to being in a position where the hospitals have to backfill those positions, there's need for additional positions as well. So from your perspective, if you're interested in working for a hospital, that's a good thing. Now, if you look at the hourly earnings over here, you'll see that hourly earnings has not, it's up, but it's not up as quickly as it had been. So from June 2022 to February 2023, it probably the rate fell in half as to the rate of of increases in hospital earnings. And when I say hospital earnings, I'm really talking about salaries there. How much did you earn as someone working at a hospital? Here we're looking at outpatient facilities. Again, outpatient healthcare services, the payrolls have risen significantly over the last several years, up almost 6% from where they were in 2020 at the very beginning of the pandemic. But within that period of time, they went up even higher and then dropped a little bit in terms of the rate of their growth. Now, this is just, I wasn't 100% sure exactly of what each of the AHEC Scholars professional directions are, but I put together this bucket. I think this covers pretty much everyone. Maybe.
Yeah, that's a good snapshot.
Okay, great. So this is what I call a rough and dirty number. Do not benchmark yourself against this number. But this is just to give you, it's interesting from a relative sense, I think, to see, how salaries play out in healthcare. And this is national median pay. So, for example, in the category that is nurse practitioners, midwives, and CRNAs, I've recruited nurse practitioners, I've recruited midwives, and I've recruited CRNAs. There is significant differences in many cases in the training that each of these people bring to the table. There's differences in the way the shifts are set up, in the opportunities they have for inpatient and outpatient practice work. There's just a lot of reasons why, if it were me, I wouldn't put these people into the same bucket and come up with one number for salaries. But that's what this is all. This particular slide you're looking at, the information is pulled from 2022 US Bureau of Labor Statistics data. And that's how it's presented. So that's how I'm showing it to you. Same thing with physicians and surgeons. There's great disparity within the salary ranges of physicians, not only geographically, but based on, as you get into specialties, certain training that some people bring to the table, other people don't have, stage of your career, family practice versus not. So I'm sure that exists with all of these other categories as well, but I thought it was interesting to take a look at just as background. And now here we're getting a little closer to home. This is Bureau of Labor Statistics information, really pretty much in New York State. Actually, with the exception of that last column, which kind of goes into the geography around Jersey City and Hoboken, which many people who are not from New York will say they're suburbs of New York City, but some diehard New Yorkers may argue with that. But I think it's interesting for this group to look at this, because you guys probably know firsthand the differences or the ballpark differences in cost of living in across some of these geographic areas. And each one of these areas falls within AHEC's sort of bucket, I think with the exception of the last column, Stephanie, if I'm right about that.
Yeah, that's right, but there are AHECs across the state elementary, so
Right.
wherever they are, they have an AHEC.
They have an AHEC, right. So this is, just something for you to use. Again, it's the mean wage. It doesn't necessarily mean this is where you're going to fall right out of training, but it gives you a ballpark so that if you're thinking of looking in more than one geography and you know that it's, I'm going to say hypothetically, 25%, I don't know the exact number, more expensive to live in New York City than it is to live in capital, in the capital region of Albany, Schenectady, Troy, then you know that salary difference makes sense. But having a son who lives down there, I think it's more than 25%, but that's just anecdotally my experience as a parent. Okay, so it's time to begin your job search. And it's sometimes an uncomfortable path to start to travel down. I've worked with folks who are coming right out of their training and they bring to the table 5 to 10 years of prior healthcare related experience or other professional experience, career experience, life experience that helps them move forward through this path in a very careful and deliberate manner. And I've worked with candidates who are looking at positions with a lot of responsibility associated with them and significant salaries. And they're folks who may have gone right through school and perhaps had a summer job, perhaps had a little bit of clinical rotation experience in their training, but not gone through the whole job search, healthcare job search process from soup to nuts. So I'm hoping that the rest of these slides will help anyone, even if you're an experienced person within a healthcare, to manage this process a little more carefully. So what are the key things? Well, let's start with the very basics, right? The very basics are your resume has to look good. That takes some effort. If you haven't started on a resume yet, I suggest you first start by making a bulleted list of what are the things you know how to do, what experience do you have, schools you've been to, any certifications you've received, any rotations that you've been through, awards, poster sessions that you've presented at, research you may have done, a whole variety of possibilities. And if you're having trouble getting started, or you get started and you say to yourself, well, I don't know, I can't really fill up a page, then what is good to do is to, first of all, do a search online, and there's a lot of great resources online, but feel free without hesitation to reach out to me, and I'll help you one-on-one, working with you to make sure that your resume reflects the full strength that you bring to the table when you are being considered for a job. I do want to say that at this moment in time, I'm not actively recruiting for any positions. So I'm pretty far along in my career, as you may be able to tell by looking at me, but I've been working since the 1980s, we'll leave it at that. But so now what I'm much more interested in spending my time helping people get their best opportunity for them to move on. And I really encourage you to reach out to me if I can be of help to you. The cover letter. People say to me, can I have a cover letter that's more than one page? It depends on what's in it, honestly. No one wants to read the same information that's already on your CV or your resume. They don't want to do that. But they do want to read a cover letter, and they want to have some context around the resume. So I would advise you to think about a few sentences in addition to the basic cover letter information, such as, again, your contact information and all of that, why you're interested in the position. But do you have a connection to the area, to the geography? Is this a group that you have some connection with? What did something happen in your personal life that made you particularly interested in pursuing this career path? And if so, is there a way to tell that story briefly without violating any concern you may have about your personal privacy, but to show someone that if they consider you for this job, you have a passion for it and an understandable passion for it, and this is why. And I give the example in that case of someone who I worked with who was at the very beginning of her job search and the very beginning of her career. And she was a physician assistant, and she had a real interest in orthopedics. And it happened that she had a family member who she was very close with, who had many orthopedic related clinical issues. And that seeing that person go through that and how the clinical diagnosis and the treatments that followed helped that person made a huge difference for her, to the point that she wanted to now pursue a career in orthopedic medicine. And that was a story that we helped craft in her cover letter. And she applied for one job because that was the group she really wanted to work with, and she landed it. I can't guarantee that'll happen to you, but it does happen. So think about that. Yes, please thank them. It's such a simple thing to do. And when I say thank them, it doesn't have to be a handwritten note. It's nice if it's a handwritten note, but it doesn't have to be a handwritten note. You just have to thank them. If it's someone who you've been communicating with by email, then by all means, or they share their email address with you, then feel free to email them. If they've, if they've shared their cell phone number or have given you permission to text them, you can certainly text them a thank you note. It's more important that you do it, and that you do it in a professional but heartfelt way. References, start to think about who you want to have provide a reference for you. Every healthcare professional that I've placed over these 16 years has needed to go through a reference check and a background check. The references are always professional references in my experience. That's the goal. Sometimes early in the career, someone will say to me, gee, can I get 2 professional references, and then can I have a supervisor from a past job that I had provide a reference? And the answer is it depends on what the employer will accept. Some employers will say that's fine. Others will say not necessarily. So it's good to at least line up those people who you're thinking of in advance and ask them, would they be willing to serve as a professional reference for you? 9 times out of 10, they're going to say yes. And then some people may say, what do you need from me? Do you need a letter? Well, that also will depend on the employer that you're looking for the position with. Some employers are perfectly comfortable receiving a letter. Other employers want to speak one-on-one with the reference. And so you won't know that until you start to get further down the path. I personally don't advise people to list the names of their reference contacts in the cover letter or on their resumes. I think it's much better for you to control who has that information and when they get it. And that way you can give a heads up individually, even if it's just with a text message, to the individual who's going to be connected. So that would be my guidance on those key points. Now you're going to start looking for a job. I always liken it. It took me a couple of years of recruiting to realize, because it had been a while. I'm going to be married 40 years this year. It had been a while since I'd been dating. But all of a sudden I realized, oh my goodness, this is just like dating. And it really is. It's just like dating. So if you think of it that way, it kind of takes you out of the process and puts a context in it that's kind of familiar. So with that in mind, in a somewhat, but not necessarily tongue-in-cheek manner, think about all the questions that are on this slide and think about them. The answers are different for every one of you. But if you really are comfortable with how you answer the question, it's going to help you through the process. I have worked with people who have narrowed the field, like that person I just told you about, to one employer. And it may be a successful approach. It may in the long run not be a successful approach, and there's some time that they could have used otherwise, but it's focused, and I support that 100% if that's what you really want to do. The thing that worries me about beginning the process and just responding to every ad you see is that it becomes very overwhelming. If you are a busy person, which I know each of you are, you don't have, you think you can keep track of it all, and we'll deal with that a little later on. But the reality is, if you just start responding and answering ads, you're going to be inundated with recruiters calling you. And I'll talk to you a little bit about why that is in a minute. So here we're going to talk about that. What you want is a job search that's going to work for you and land you the job that you want with the best possible salary, benefit structure, hours of work, all of that. In healthcare, the landscape is complicated. There are many variables that go into differentiating one opportunity from the next. So you can look at, let's say for a physician, you can look at 3 family practice positions. 2 of them can be part of the same large multi-specialty medical group, but in different geographies, different geographic location offices. And the third one is a hospital employed position as an outpatient family practice doctor. There are nuances that make working in each of those places different. And there are reasons why the packages that you may be able to accomplish, the compensation and benefits may vary to some degree, or hours of work or other things. A good, solid recruiter, someone who's experienced and knows healthcare and understands the healthcare landscape, has taken the time to understand the nuanced differences between every position that any employer they work with has, and can represent those to you on the first call you have with them in detail. Now, they can't necessarily walk through the clinical detail differences with you, but they can, in fact, walk through the operational differences, the compensation and benefits components. They can walk through some of the hours of work, on call versus not on call, questions that are going to make a difference in your life. And questions, base salary, opportunities for bonus, sign-on bonus, all of those things. That's going to allow you, if you can have a recruiter who understands that, and you can talk with them about that in the first conversation, think of how much time that saves you later on if it turns out that it's not a workable option for you. Maybe the salary is much lower than you thought. Maybe the hours of work don't work for you because you have other commitments that you have to put into consideration. Maybe they're not open to a 30-hour work week. A whole host, maybe there's a hospital inpatient component that you don't really want to deal with in your practice. Or maybe they're going to require you in the course of a 4-week period to practice out of 3 different locations. And that's not something that you want to do, particularly at this stage of your career. So those are the kind of things that a good recruiter can help you tease out in the beginning. And you want to make the most of that relationship with a good recruiter. You're going to be able to tell if the person is a good recruiter by asking smart questions. And the way to ask smart questions is to think about the experiences that you've had in your training and what you've seen that you've liked and what you've seen that you haven't liked. And even think about it, if you're going to be in a clinical environment of any kind, think about it from your own experience as a patient, what you like and what you don't like. I always ask the question, and I know it's a crazy question, well, maybe it isn't, of my clients. I want to see pictures. If they're in another part of the country, I want them to walk me through with a video tour of that facility. And what am I looking at? I'm looking at how clean it is. I don't tell them that's what I'm looking at, but I'm looking at how clean it is. Because if that place is clean, and if I say to them, can you open the drawer in that exam room? And they open the drawer in that exam room, and then they go to the next exam room and I say, would you mind opening that same drawer? I'm looking at whether or not the same supplies are in the drawers, the same drawer in each exam room. So if you're floating within a hallway, or you get to see patients in a different hallway, do you know where everything is going to be? Will you be able to learn that quickly, or is it not organized? Because that's a reflection of how smoothly the practice runs. And that's something that will make your life different if it runs smoothly, or if you're hunting and pecking, looking all over the place for basic supplies. It should be, in my opinion, in the same place everywhere you go. Just a thought to keep in mind. Online job boards. If you've started your job search at all, you know that there are huge job board websites. So everything from ZipRecruiter to Healthy Careers to, any medical association will have their own job board on their website. New York State Physician Assistants Association, the National PA Association, you name it. Any one of your fields will have their own specialized job boards. And then there are these larger ones. So how does that work exactly? Well, for you as the user who's looking for a job, 9 times out of 10, they're going to ask you to register. In order to do a thorough search of the jobs that are available, you'll be able to search based on a variety of criteria. You'll put the criteria in that are the most important to you. You'll click a button and you'll start to see jobs. Well, let's back up. What does that registration process involve? They are almost always going to ask you to load your CV or resume into their system. That's something that you have to be very careful about, and you have to be aware of, and you have to remember that you've done. Because what happens is that resume becomes accessible to any employer that's advertising on the job site in most cases. Not every case, but most cases. And in fact, it becomes a product that the recruiters purchase. So it's a moneymaker for the job boards in most cases. And what's interesting about this is that while it looks to the user that all of these job boards are separate, and your organization that you pay membership dues to has their own job board, and mine has its own job board, a lot of them are aggregated and they're all run by the same organization on the back end. And those resumes are in those systems. And I've seen people who have their cell phone number and their email address and their home address and their medical license numbers or their NPI numbers, all kinds of information on there. With other generations of healthcare professionals, when I first started doing this in 2006, I used to see people putting social security numbers on their information and then submitting it. So you have to just know that that information is no longer going to be within your control in terms of who who's able to access it. And so that's something to take care of. Now, you have to have enough contact information on there that someone can reach you. But many people that I work with set up a separate Google phone number, just for job searches. They will set up a separate email address that's not their personal email address. And they only use that email address during the time of their job search. And then when they accept a job, they stop, they close out that email account. So that's something to think about, what you want to do or not. And then the other thing that's going to happen with that is that as your information is up there, you're going to start to be contacted by many recruiters who see that you will have one basic skill set that they need in their positions that they're advertising for or not advertising for. And they're going to reach out to you and try to get some information from you and see if you're interested. And that, I can assure you, most of the time is going to fill up your inbox, fill up your voicemail, and probably not be something that you're interested in the long run, because if you were, you would have answered that particular ad directly. So that's just something to think about. I also think the other thing to think about with this, as you're looking at this search, is LinkedIn. If you're not on LinkedIn, and I'm always surprised at the number of healthcare people that are not on LinkedIn, there's a lot of hiring that happens through LinkedIn networking. And just having some key information, you don't have to have a tremendous amount of it, but just having some key information and starting to make some network contacts through LinkedIn, I would say, is pretty much not required, but highly advisable at this point. Okay, so now you've applied to 5 positions. What should you expect from them, and what are they going to expect from you? Well, let's start with what they're going to expect from you. They're going to expect you to respond to them within the same day that they reach out to you. And if not, that's not possible, certainly within 48 hours. They're going to, and it doesn't have to be a long, lengthy response. It can be something as simple as, thank you for reaching out to me. I'm looking forward to speaking with you. I'm tied up with whatever it is, school, work, for the, until such and such a date. Can we schedule a time to connect then? That's all you have to say in return. And it sets an expectation on both sides as to the pace of how fast this is going to move. Now, what should you expect from them? Well, I think you should expect a timely response as well. You should expect that if you answer them, that you're going to get an answer within a day or two. And you should expect that every step of the process, as it plays out, they are going to be careful to keep you informed of what the status is, to advise you as to timeframes, in other words, when can you expect the next step, if there is such a next step? When would they ideally like to have the position filled? They're going to ask you when you're available. Be honest. You don't have to be available the day after you're licensed. If you have other plans, if you already have things that are lined up, people have weddings, they have travel plans, they have they're moving, all kinds of things. Just set clear expectations and always be honest. And I think that's exactly what you should expect from them. That they're honest and that what they say to you is clear. And things can change, that's understandable, but at the time that they communicate, they've communicated in a forthright manner, and that they keep you in the loop. So now you've scheduled the interview and you want to know exactly what's going to happen. So you should receive from them an itinerary. It should tell you, set forth the location, the time that you're supposed to arrive, the individual who's going to meet you and where, the people who you're going to meet that day, then their titles, if you're going to be traveling to different locations, where that will be, approximately when they anticipate the end of the day to be, or the end of the interview to be. Is it an hour-long interview or is it a day-long interview? I've worked with employers who just tell someone to come to an interview, and the employer has planned a 4-hour, getting to know you session with a variety of different departments and people and administrative people. And the interviewee had no idea that it was going to be 4 hours long. They just in their head assumed this was going to be about an hour and a half. So make sure all of that's clear. If they don't tell you that in a very clear written manner, that's something to remember. That, in my mind, is a flag of attention to detail and operational smoothness of their processes in general. But if it's a group you're really interested in and they haven't told you that, and you want to pursue this, by all means, pursue it. Ask them for the information. Take notes as they're asking you, as they're answering you, or ask them by email so you can get something back in writing, and then you have it and you know what you're walking into. Please don't schedule the interview when you know you're going to be in the middle of final exams, or having just been on call for 24 hours, or scheduled to work some crazy shift and you have a big project due. And oh, by the way, you also have to go out of town that weekend because you have a family, obligation that you have to meet. I actually had a doctor, a wonderful doctor, who went on a job interview and fell asleep in the middle of the interview. As the people were talking, she was meeting a hospital administrator, I think it was their chief financial officer and their CEO. And as she was sitting across from both of them, she fell asleep. Now, they didn't know what to do because she was sleeping, but it happened. And did they ultimately hire her? No. But did they hold it against her? No, they didn't. They took it, as one of those things that happens to people who are trying to do the best they can in all things, and oh, by the way, also looking for a job. So they were good-spirited and good-natured about it. I ended up placing her at another job that she stayed at for about 6 years and loved and did really well at. But it's better not to fall asleep if you can avoid it. So that's kind of my takeaway on that. And then just think about what you really want to know about their practice, and think about what they're going to ask you. So, you can look up what they can legally ask you, but really they're trying to get an understanding of how good a fit you are for the group that you're going to be joining. And so they may ask you things like, tell me, do you like to travel? What do you do in your spare time? All kinds of things that aren't related to your clinical skills. And I think that's just, on the one hand, people do that because they just want to put you at ease. On the other hand, you don't have to answer some of those questions, but if it's, it's up to you to decide. I think that by and large, particularly up in our area, I see some of that as just people trying to get a feel for, what is it going to be like to work with this person. The best choice for you is not necessarily the best choice for the person sitting next to you or any of your other colleagues in your scholars program. But you're all going to have to think about all of these different things. There's a lot of issues. You're going to have multiple opportunities. I can assure you of it. That's why I gave you the information at the beginning about the rate of growth of jobs in your fields, and the number of positions that are available and will continue to grow in healthcare over the coming years. You'll be going on multiple interviews. It's very rare that someone interviews at one practice and ends up working there and doesn't interview anywhere else. In fact, I would kind of advise that if you at all have any hesitation, please do interview at more than one place. Don't waste someone else's time and don't waste your own time. But if you have hesitation, by all means, you should look at other things. You'll likely get multiple offers. The timing may not work out with the multiple offers. You can get an offer on May 5th, tomorrow, but the job that you really want, you haven't heard back from yet, and they're not likely to get back to you until early June. So now you have to think about, what are you going to do? Well, you can call me because I'll help you with the individual circumstance. We'll talk through it, and we'll think about strategies as to how to juggle that and what you can do to see if there's a way to give yourself a little more time with the first one and condense the time frame a little bit with the second one, and see if you can make that happen. Negotiations are going to be different with every employer. And then you have to be able to evaluate what all those differences are. And sometimes it's comparing apples to oranges, but you have to do that, and then also trust your gut. Your gut is your good friend in this process. I call this the opportunity scorecard. And because you're juggling so many different things at once, you're not in a position usually where the only thing on your plate is your job search. Keep a spreadsheet. I don't care how fancy it is. I don't care if it's a piece of paper that you keep on your desk or in your pocket, that just has the name of the group, the job title that you responded to. You should somewhere on your computer have a copy of the ad. Make sure when you never respond to a position without saving a copy of the ad you responded to. Who contacted you, put their name down and their contact information. Things happen, emails get lost, all kinds of crazy things. And then little notes, what they said, what you want to ask them, something you thought about, whatever's useful to you, but keep that all in one place. And as this plays out, it's going to help you. I promise you, this will be worth the effort. The people that don't do this, after you've applied for 3 jobs, it becomes confusing. It just does. You don't know the people by face. There's a lot of names getting thrown around, different hours, different details. This will help you. And I can help you put it together if you would like. Contract negotiations. This becomes intimidating for a lot of folks. I understand that. I studied labor relations as an undergraduate in college, and I have negotiated contracts with labor unions in my career, big labor unions. And negotiating an individual contract is no less intimidating than negotiating a contract that affects thousands of people. And why is that? Because when you make one mistake, it can have significant ramifications for you. And they can be financial and they can be otherwise. And they can have long-term effects that you may not be thinking about. So you have to be very deliberate in your negotiating style. But you also can't be intimidated by it. Don't think that you shouldn't negotiate any offer that you receive. So are you expected to agree to every term? Take it or leave it? Well, with some employers, yes. Who are they? You only know that when you meet them. So there are some employers, and it frequently depends on what your particular profession is. So with physicians, it's different. My experience is that there's more you can negotiate generally as a physician than you can as a registered nurse. And that just varies by occupation in many cases. But that's something that you won't know until they offer you the position and they start to discuss those particular terms with you. What leverage do you have? And we'll talk about that in a minute. And think about not only what leverage you might have, and remember the statistics that I showed you at the beginning. There are more jobs than there are people right now trained for those positions. And it varies by field, but as a rule in healthcare, that's the way it is right now. And so the job market is very good. And that's why I said previously that you will probably get multiple offers if you apply to multiple positions. It's not uncommon for that to happen. It's not guaranteed, but it's not uncommon. But you have to think about what are the fundamental things that you must have to make this work for you. And we're going to talk about some of that now. So here on the left side, you're going to see, what do I need? And you know what? Make a list, needs and wants, and just put a 1, 2, and 3 on next to each item for yourself. And this is by no means meant to be a comprehensive list, but it's a place where you can get started. So geographically, where do you want to be? What do I need? Well, I really want to be in a big city, or I want to be on the East Coast, or I want to stay in New York, or I must be in a rural area. I can't stand the city, but I want to be within 15 minutes of, a movie theater, whatever it is for you. What schedules are you flexible enough to work at? Will you consider 40 hours a week over the course of 3 days? 1 week and a different schedule the next week, nights and weekends, evenings only, starting at 7 a.m., finishing by 3. Do you need to drop off kids in the morning? Do you need to be home? Do you have other commitments besides that confine your time? Think about that. And what work settings might accommodate someone with those scheduling needs? Minimum salary requirements. What specialty opportunities are there? The benefits package. What must the benefits package have in it? Now, not every group is going to offer you the same benefits package. And there are differences in paid time off. There are differences in things like reimbursements that you'll find, CME allowances, that kind of thing. Malpractice coverage is huge, and we'll talk about that later on. And what does the support look like for you to be able to get your job done and function to the highest level of your license within your profession without being bogged down by administrative and other tasks that someone else in the practice can do who doesn't have your qualifications and level of training? That's important. And that's something that you need to ask about, and you need to see firsthand when you go on an interview. What do I want? Do I want administrative or patient care? I work with many people whose long-term and in some cases short-term goal is to take their clinical training and channel it so that they also have administrative responsibilities, overseeing a program, managing a group, that kind of thing. Do you want to work hospital-based or community-based, or in some cases remotely, completely? Some cases a mix. What's the minimum amount of paid time off that you need? Bonus opportunities, that's a big one. Some places will offer you a sign-on bonus. What is that sign-on bonus and how is it structured? Many of the sign-on bonuses, but not all of them, are structured as advance payments on retention bonuses. So what does that mean? That means that if I'm the candidate, I accept the job, I'm told I'm going to be getting a bonus payment when I start work of, let's make it $20,000, okay? But I'm asked at the time that I accept the job or sign the contract to sign an additional document which defines the bonus structure and the payment of that bonus. And what it usually will say, it'll have terms in it. And one of those terms might be that the bonus that you're getting up front that you think of as a sign-on bonus is in actuality a prepayment of a 3-year, usually, retention bonus. So that if you only work for this group for 1 year or 2 years or some other portion of a 3-year term, you can leave there earlier, but you owe them back the prorated difference of that $10,000. And they'll have you sign something to that effect. So you need to understand that, ask questions about it, and it may be perfectly acceptable. Many people are perfectly fine with it. There's nothing wrong with it. You just want to make sure you understand the terms. We talked about how many locations does the group have, and do you want to go to? Will they support moving you to if you need to move? Usually you have to move, my experience, about 120 or 150 miles. There's some IRS regulations about them being able to pay you relocation allowance and a minimum number of miles that you have to relocate for them to do that. But that's something that you might need. It's something you might want to raise with them. Loan repayment assistance, Stephanie spoke about in the beginning, CME money, licensing. In my experience, most healthcare organizations will not pay for your licensing fees, because that's a requirement of your job that you're supposed to have on day one. But they will give you some allowance depending on your position, potentially for dues reimbursement. And so think about, what do you want to negotiate? But very importantly, don't just think about it from your perspective. Think about it from the perspective of the employer. What will the employer be willing to negotiate? And are any of the things that they won't negotiate deal breakers for you? So, if they say, if you are not willing to work on the weekends, and they say to you, this position requires that you work on the weekends, that's a deal breaker for you, right? I'm going to assume in this scenario. So you want to know that, and you want to know it. If it is a deal breaker, you want to kind of get through that in the beginning so you're not wasting your time or their time on the process. Leverage. Well, what's your leverage? In a negotiation, you have to think about your leverage. Anyone who's ever been a parent knows that. You have to think about what's your leverage. And your leverage is, well, in this case, what's the difference between the demand for your people with your skills and the supply? Is there a gap there, particularly in the geography that you want to work in? Do you have a unique set of skills or experience that makes you more attractive to them as a candidate? An example of this is, are you bilingual by any chance? Just as one example, if you're bilingual, you may in fact be more valuable to that particular practice if the language or languages you speak are present in the communities of the populations they serve. Do you have ties to the community? If you haven't lived there, did you go to school there? Do you have family members who live there? Do you have interests that bring you to that area? I can't tell you how many people I've recruited to the capital region because they like hiking and skiing, or they love, being out on a lake. And so some of them have never visited here until they came for an interview. But I talk to them I try to find out what it is that they enjoy in their personal life that I might be able to help connect them with here. And we've done that with a whole variety of different candidates and different interests. And does the employer know you? If the employer knows you, that's huge for you. If you did a rotation with them, if you have someone in common who is a professional colleague of theirs, someone who, personally or professionally, who may have been a college friend, LinkedIn is pretty good for that, actually. LinkedIn will help you see if you have people in common with some of these folks who may be on the other side of the hiring question. Now, if you're presented with an employment contract, and not everyone will be, but if you are, the first thing and the most important thing, if you take nothing else away from this presentation, remember this: always consult with an attorney when you are offered an employment contract that you have to sign. If you are offered and sign an employment contract, you are legally bound by those terms. And it is incumbent upon you to make sure that you understand every single component of that contract and exactly what you are committing yourself to. It doesn't mean you should not sign the contract. It just means you must understand all the legal implications of it and an attorney can help you with that. Ideally, a healthcare attorney who understands the healthcare environment. But if you don't know a healthcare attorney or can't find one, which there are many of them, just Google them, then certainly an attorney. And many of the people who've helped you along the way in your training can help connect you with an attorney that they've used for similar circumstances. So if you have a mentor, if you have a professor, if you have clinical colleagues you've worked with who you trust, ask them, and don't be shy about asking them. They're happy to help you. It's customary to negotiate some terms. What those terms are, like I said, will vary from employer to employer, but many times there are negotiations that can take place. I have not seen employers be willing to negotiate any of the 3 terms you see here. Confidentiality, that's a must usually. You must keep their information confidential, both from a HIPAA perspective, as well as the clinical business information and the non-clinical business information of an employer. Non-solicitation, you can't go after their patients once you leave or their clients. And disparagement, that section generally speaks to you not being able to speak poorly of them and them not being able to speak poorly of you after you leave or while you're there, usually both. So those are non-negotiable by and large, but there may be other components that are negotiable. So here are some of the things that you have to make sure you understand and are explained to you. Termination without cause clause, and I'll talk about that. Reimbursements, malpractice coverage, all of the things you see on this screen. These are all components that are going to be laid out either in the contract itself or in a letter attached as an appendix or a side letter to an agreement. But you have to know and understand all of this before you sign on. So why do you need a termination without cause clause, and what is it? Well, it's a clause in the contract, a section that defines how much time you or your employer have to give to each other in order to terminate the employment agreement. And that means that, let's say, from your employer's perspective, you didn't do anything wrong. They've just decided that they don't have the finances anymore. They're going strategically in a different direction clinically. The funding for the program has changed. They're no longer going to be employing people on a full-time basis. They're moving to a part-time model because the hours of operation are changing, a whole host of things. They're outside of your control. They want to retain the right to let you go. And I've not yet seen a contract that doesn't have an employer right to termination without cause clause inside in that. What they don't always have in it is the employee having that same right. And so what you want your attorney to look at and protect you for is to make sure that you are given that same right. So if they have to give you 90 days notice, you want to be able to leave there by giving them 90 days notice. You decide to move, you want to go work in California, you decide you're going to take some time off from your profession and go back to school, whatever the reason is, it's not the issue. The issue is you have the ability with the appropriate amount of notice to terminate the contract. And that's really crucial that you have that in your contract. Pay attention to the non-compete terms. Many contracts in healthcare, the overwhelming majority of healthcare contracts that I've seen do have non-compete clauses in them. And they will address all sorts of things. The non-compete kicks in once you sign the contract. So there are non-competes that not only talk about what you can and cannot do after you leave, but what you can and cannot do while you are working there. So you know you can or cannot pick up a part-time per diem gig at the local nursing home in order to make some extra money, one shift a month. No, you can't do that. There's different requirements, and an attorney will walk you through that and help explain it to you. You can see from the slide that there are questions that you need to be asking. The non-compete in New York State has to meet 4 criteria, and there's a website sort of sheet on this from the Attorney General's office in New York State. But in New York State, if that's where you're going to work, the non-compete has to meet these criteria. It has to protect legitimate interests of the employer. So it can't just be that you can't compete with them just because you used to work for them. There has to be a legitimate business interest that they're protecting. It also can't impose an undue hardship on you, meaning it can't be so broad, let's say geographically, that you have to relocate in order to be able to work. That cannot happen in New York State. It can't harm the public. What does that mean? It means if you have a special skill and expertise that is not easily available in your community, and there are people in the community that rely on getting care or services from you because of that special skill that you have, they have to still be able to travel to a point where they can access the care from you. And so that's a very important protection that's given in there. And then it has to be reasonable in time period. I've seen them when I first started in healthcare, 5 years was not uncommon. It's less common now. They're generally in the 3-year range, depending on the position you hold. It could be 12 months. And the geographic scope varies. It could be by county, it could be by miles, it could be by radius from the location that you worked. I've seen them where and if you work at 3 locations, it's by the radius from all 3 sites. Even if you were only at one site for one afternoon a week. And it could be by county. I'm not sure if I mentioned that. So it's important for the attorney to help you tease through that and understand what the real life implications of those requirements might be for you. Now, nationally, there's been a movement to ban non-compete clauses across not just healthcare, but nationwide in any kind of contract employment agreement. That was proposed earlier in the year. The public comment period on that proposal recently closed. I don't know if it was extended. Sometimes that happens, but once that public comment period is closed, it'll take some time for the FTC to review those comments, to make any revisions, and then to move forward with the process from there. So keep your eye on that. We'll see where that ends up over the course of your career. That could have a significant impact for you, though. If you're not going to be looking for a job in New York, you should be looking into what the non-compete restrictions are, or have an attorney who's familiar with the state that you're planning on working in and licensed in that state. Malpractice coverage. Now, I don't know about all of you, but for many of you, you will need malpractice coverage. And generally, not always, generally the employer provides malpractice coverage. There are circumstances where you will be hired and asked to provide your own malpractice coverage. Usually that's if you're hired as a contractor, and that depends on a whole variety of other things. But by and large, this is something that the employer will provide to you. Don't just assume every malpractice coverage opportunity is the same as the next. There are differences. There's differences in the types of coverage. I'm just going to talk about the 2 big buckets here, because an attorney will go through this with you in more detail, with questions and answers relevant to this particular positions you're looking at. But occurrence-made malpractice is really what we call, that's the one you want, you know, in layman's terms, in the sense that it covers if you were covered by occurrence malpractice at the moment in time that the event happened that the malpractice claim is being made about, you're covered whether you're working for that employer at this year and a half later or not. So you're working, let's say you go to work for a hospital system, you're on the job for 3 days and somebody files something happens in the department that you work in. You're one of the named people in the malpractice suit. You may have had deep involvement or peripheral involvement or no involvement in it, but you were there that day and you get named in the lawsuit. By having occurrence malpractice insurance coverage, you are within the boundaries of the malpractice insurer provisions. You are covered, whether you work there or not at the time, and as the process plays out. Now, with claims made, that's not necessarily the case. Claims made insurance protects you only if you are either still working for the company. Well, let me put it this way. Only if the insurance company that issues the claims made policy is the same insurance company that's insuring your malpractice at the time that the claim is actually made. So they have to be insuring you when the incident happens, and they have to be insuring you at the time the claim is made. Well, that's generally the case if you continue with the same employer, or there's some other things that they can do. There's something called tail insurance. There are other things that the employer can do to make sure that all of the clinical people who are covered by their plan, if they switch the type of coverage they have, continue to be covered for the period of time that claims could potentially be filed. And there are timeframes that are relevant to that. It's not an infinite time frame that you would have exposure. But if you choose to leave your employer, you get another job, you go to work for a different hospital. The first hospital had claims made, the second hospital has occurrence made. You may in fact have to look at buying tail and coverage yourself. And I talk about this in this next slide. You can come back and reference this, or I can talk it through you privately if you like. Or you have to see if you can negotiate with your next employer the possibility of them either subsidizing or paying the cost of the tail insurance. And that can be in the range of $6,000, more, less. It's not a small amount of money. But it needs the coverage, the tail needs to cover you for the period of time from the time you leave and are no longer covered until claims from that date could no longer be made against you. Okay, so your lawyer's going to work all that out with you. The good news is you've been offered one or more jobs. Congratulations, you worked really hard to get here. We're rounding the bend. This is where the fun really begins now. You have the offer. You may in fact have 2 offers or 3 offers. What does the offer letter look like? It's going to look like something different from each employer. They all do the same thing in different ways. Could be an email, could be a letter you get in the mail. It's usually an email these days. It's going to be a brief statement of basic terms. Some hospital systems that I've worked with have more details in it in the offer letter. They'll go into hours of work. They'll talk about the salary. They'll give an anticipated start date. Usually the anticipated start date is a ballpark estimate, particularly for new graduates who have to go through licensing and credentialing and all of that. They'll have they'll talk about hours of work, what your title will be, very basic stuff. They may have something in there potentially about what types of coverage you have in your benefits package. Sometimes there's an attachment to the offer letter. Sometimes you have to ask for a copy of the benefits package. But by and large, it's an offer letter. They'll tell you if they're going to offer you a contract that you have to sign, they're going to say it in that offer letter, that a contract will be, an employment agreement will be forthcoming, or they'll tell you that you will be hired as an at-will employee. What does that mean? It means that you will not be signing a contract and you'll be hired as a regular employee of either the group or the hospital or the health insurance plan or whoever you go to work for. And you will, as an at-will employee, be working at will. So you, with the appropriate amount of notice, can leave, or they, with the appropriate amount of notice, will terminate you without cause, or terminate you with cause, which they can do. If there's cause, there'll be contract terms that will allow them to do it, whether or not you're an at-will employee. And the question that I get a lot is, what if I sign this? Because usually there's a line for you to sign it at the bottom. If I sign it, am I bound by it? You're only bound by an offer letter, technically, if the offer letter says this is a binding offer. This letter is a binding offer for you to accept the position or for the position of. And so it'll clearly state that it's a binding offer. So you can sign assuming it doesn't say that. I've not, and again, I would run this by an attorney, but I have never known an offer letter to be a binding offer unless it specifically states it. And the reality is, don't sign it unless your intention is to join them. Things happen and things change. I've seen employers rescind an offer letter. Circumstances on their end change. Someone who was going to retire suddenly decides, you know what, I've decided I'm not going to retire. And so the position's not available, or something else happens and they rescind the offer. Sometimes the offer letter comes in pending reference checks. It will usually say that, but not always. But you will, you should ask if the reference check process has been completed. You can ask your references if they've already completed the process for this employer, so you'll know. But assume that if the reference checks don't come back positive, that will impact the offer that will be made or that would have been made. Everything is great. You've decided which job you want. The offer is accepted. You accept it. They love you. Now what happens? Now the fun begins. Make sure your licensing is in place or in process. Make sure that you've used this time now to line up all the documents you need for that process to happen. If you're in a position that requires credentialing because of how reimbursements are structured, that credentialing process will play out. There'll be a lot of credentialing paperwork for you to fill out. Some employers do most of it for you. Some employers help you a little. Some employers will assign someone to assist you with the process. It just depends. But that's something that will be time consuming. You'll need whatever certification exams you have to take to be under your belt and the results to be in. And you have to firm up your start date and get your ducks in a row. And then I always put this at the bottom. Don't forget about your CV or resume that you've uploaded on those websites. You can take it down, but remember that that information is already out there, and do your best to be aware of that and control that as much as possible. So that is that. And I'm happy to entertain questions if there are any. This is my contact information. I am looking forward to speaking with you and looking forward to helping you in any way I can. Feel free to contact me now. There is no time limit on this offer. It does not expire. So you can reach out to me and I will gladly work with you and give you any guidance that you may ask for or may be helpful to you. I look forward to hearing from you. And thank you for listening.